Welcome. Today, we're going to be talking about something incredibly important: pediatric airway management. Knowing how to help a child who's struggling to breathe, it's a profound responsibility. This is vital information, and I'm really glad we're diving into this together.
First things first, we have to understand that a child's breath truly is a precious gift from Allah. And because of how they're made, they are so much more vulnerable than adults. Their airways are tiny and they have very little oxygen in reserve. This means when something goes wrong, things can get serious really fast. So here's how we're going to break it all down. We'll start by looking at why a child's breath is so fragile. Then we'll get right into the basic, hands-on maneuvers that can save a life. From there, we'll talk about some of the tools that can help, touch on some advanced support, and we'll wrap it all up by talking about what this knowledge really means for us. All right, let's jump into our first section, the fragility of a child's breath. See, before we can learn how to help, we really need to get a handle on why it's such a unique challenge in children. This right here breaks down the key reasons. Think about it. A smaller airway diameter, it's just going to get blocked that much easier. Less oxygen reserve means we have way less time to act, and their soft tissues can cause obstructions that you just don't see in adults. On top of that, you have things like lung diseases or even issues where the brain's signals to breathe aren't quite right. It's all part of the intricate way they are created, and it demands our special care. Okay, now that we see the challenge, let's talk solutions. Section 2 is all about basic life-saving maneuvers. These are the immediate actions you can take, the first line of defense that, by Allah's will, can open that airway right back up. The first and most common one is the head tilt/chin lift. It's actually beautiful in its simplicity. When a child is unconscious, their tongue can just relax and fall back, blocking everything. This one simple maneuver physically moves the tongue out of the way, clearing the path for air. And here's exactly how it's done. You put one hand on the forehead, gently tilting the head back. Then, with the fingers of your other hand, and this is important, you go under the bony part of their jaw and you lift. It's amazing how this simple change of position can be the one thing that, by Allah's permission, restores breathing. Now, getting the technique right is absolutely everything, and that means knowing what not to do. You don't want to press into the soft tissue under the chin. That can actually make things worse. Don't use your thumb, and don't close their mouth completely. Being precise here is what makes the difference between helping and hurting. So, what happens if you think there might be a neck injury? Well, tilting the head is a big no-no. That's where this next maneuver comes in, the jaw thrust. It does the same job, it gets the jaw and tongue forward, but it does it without moving the head or neck one bit. To do it, you'll place a hand on each side of the child's head to keep it perfectly still. Then you find the angles of their lower jaw with your fingers, and you lift straight up. It's an incredible technique that protects the delicate spine while still opening that crucial airway. All right, let's move on to section 3. Sometimes those basic maneuvers just aren't quite enough, and that's when we can turn to some specific tools, instruments that Allah has inspired us to create to aid in the sacred duty of preserving life. But before you can use any tool, you've got to clear the way. The airway might have secretions, blood, or vomit in it, so the very first step is almost always suctioning, making sure that path is totally clear for air to get through. And the details here are so important. The suction pressure has to be just right. For kids, that sweet spot is between 80 and 120 millimeters of mercury. If you go too high, you can damage their delicate tissue. But if you go too low, it's just not going to work. Getting this number right is key. Once things are clear, we can use what are called adjuncts to keep the airway open. And there are two main types: the OPA, which goes in the mouth, and the NPA, which goes in the nose. The big difference? The OPA is rigid, and it's only for a child who is completely unconscious with no gag reflex. The NPA is softer and can be used for someone who's conscious or semi-conscious. And as you can see, choosing the right size for either one is absolutely critical. So that brings us to our fourth section, advanced breathing support. Now, we're talking about techniques that are for trained professionals, used when a child is in respiratory failure and literally can't breathe for themselves. The first and most fundamental advanced skill is bag mask ventilation. This is a cornerstone of resuscitation. And, when it's done right, it can be just as good as putting a tube down their throat, especially for short periods. It's all about delivering oxygen directly to the lungs. So how do you know you're doing it right? You look for these signs. Are you seeing the chest rise and fall with each breath? Are their oxygen levels and heart rate getting better? These are the indicators, the signs that, by Ola's will, your efforts are working and that life-sustaining oxygen is getting where it needs to go. Another amazing tool for advanced providers is the laryngeal mask airway, or LMA. This is what's called a supraglottic device, which just means it sits right above the vocal cords. It's an essential piece of kit that can be put in really quickly, especially when other more invasive methods aren't working or aren't an option. And what's so great is how clear the guidance is. Success with an LMA all starts with picking the right size. This table just takes all the guesswork out of it. It links the size you need directly to the child's weight. It's a simple step, but it's absolutely crucial for making sure the device seals properly and does its job. And finally, let's bring this all home in our last section. We've talked about maneuvers and tools, but the most important thing is realizing that this knowledge is a sacred trust. It's our responsibility to learn it and to be ready to act on it. So let's just quickly recap the big points. We have to remember how fragile a child's airway is. We have to master those basic maneuvers, the head tilt/chin lift and the jaw thrust. We need to know our tools, suction, OPA, NPA. For the pros out there, advanced skills are vital. And for all of us, being prepared isn't just a nice idea. It's a fundamental part of our duty of care. This quote really says it all, doesn't it? Rapid clinical assessment is important to ensure life-saving interventions. See, just knowing this stuff isn't enough. We have to be able to see what's happening and act quickly and decisively when a life is hanging in the balance. And that leaves us with this final thought. This isn't just a bunch of information, it's a call to action. So the real question, for you and for me, is this: how will you prepare to use this knowledge when it matters most?